evening. Let's get started. I'm Bernice Lacey. I'm on the ProPlan breeder team, and I'm very excited to welcome cat breeders from across Canada to tonight's webinar, Perfect Beginnings for Cat Breeders. Our speaker is Dr. Liz Ruelle. I'll just be calling her Dr. Liz from now on. She's only one of the handful of board-certified female feline specialists in Canada, and is the owner and practicing veterinarian at the Wild Rose Cat Clinic of Calgary. Dr. Liz, before we get started, I just want to ask you a few get-to-know-you questions. Are you ready?
I'm ready.
Okay, great. Your veterinary career has been entirely focused on cats, 18 years and counting. Why have you chosen to focus on cats?
So I always wanted to be a veterinarian. And when I was a kid, I actually wanted to be a horse vet. And then when I went through school, I always grew up with cats. So I should always say that I always had cats in my lives. Chocolate Point, Siamese, apple faces have a very soft spot in my heart for a reason. And when I was in vet school, I realized that my arms aren't long enough. I'm not quite tall enough. And I ultimately really like to work in a climate controlled environment, especially, the unpredictability of Alberta weather. And so when I graduated, I was looking for a job and I fell into cat practice and I never left. And I kind of think at the end of the day that, the cosmic force is meant for me to be a crazy cat doctor. And so I think that's where the cats put me here. So
nice.
I really do love them.
That's great. And I know you work with many breeders at Wild Rose Clinic. Yes. What's your favorite part about working with breeders?
The kittens.
Yeah.
Yeah. No, it's the kittens is probably the easiest choice answer because oh my goodness, how are they not cute and so hooliganistic? And I just get to love them and then send them back to be hooligans somewhere else. But I guess also finding individuals who are as passionate about cats as I am and trying to get that passion in people's homes. I think, like I said, I always had cats growing up. And, I can remember having a bad day as a kid. I'd go and I would just burrow my face into my sleeping cat's belly. And there's this sweaty cat smell that just is what a cat smells like. And it's such a happy childhood smell for me. And such, they're truly gifts. And I just love that that gets shared on, but definitely kittens too.
I could see that. That's good.
Yeah.
Okay. And the last question. I know many of us celebrated Thanksgiving this past weekend. So what are you looking forward to this fall for some fun?
Well, right now I have 2 kids, and so I'm back to being a hockey rink mom. So I actually really like watching my kids at the hockey rink. It's been amazing to see their skills develop on the ice. They are definitely way better skaters than I am, but I'm really proud to see them on the rinks. And from getting off over the chaos of summer, it's kind of nice to be back in routine and have them back at school.
Yeah, I hear you.
I must confess. So yeah.
Great, fantastic. So thank you. Well, our agenda for tonight, we'll start with Dr. Ruelle's presentation, a short message from me on ProPlan and our breeder program, and then we'll head into 15 to 30 minutes of question and answers, and we'll wrap up before 10 p.m. Eastern Standard Time. So before I turn it over, though, I have a few housekeeping items. We're a big group today, so we're going to keep everyone on mute during the presentation. Please enter your questions in the Q&A box that's at the bottom of your screen. Anytime during the presentation, you can do that. Please take a moment to note the difference between the Q&A and the chat box. I'll only be pulling questions from the Q&A for Dr. Liz. Feel free to communicate in the other box if you like. And finally, we ask that you keep your questions to general topics versus specific to one of your cats. And that's it. Over to you, Dr. Liz.
Okay. Well, I first just want to open by just saying a very big thank you to our wonderful sponsor, Purina ProPlan from Purina, and all the amazing team that made this happen. I love to share my cat knowledge, and it's just very exciting. I appreciate this opportunity. The bottom says, "Here for the love of cats and cat medicine." That is my clinic, I guess, logos, saying, mantra. This is certainly what I live for every day. As Bernice asked in the initial kind of who am I part of it, I've always had cats. They're a huge part of my life. I love their medicine too, and I just want to share that message with everybody. So there was, I guess you already know a little bit about me. So just to reiterate, I guess technically in cat years, I am a geriatric veterinarian. I've been a cat vet since 2005. I've been a board certified specialist in feline practice through the American Board of Veterinary Practitioners since 2012. And that is me at work. And I just love those kitties. So my goal for tonight's lecture, so when I was asked to do this talk, I was trying to figure out what the best kind of what I best I want to get out there. And for me, it's I love my cats, and they are part of my family. I have two kids. My son is 10, my daughter is 8, and my son was trying to bug me a few months back, and he was like, "Mom, who's your favorite child?" And I said Utini, which is our cat. And he's like, that's a cat. And I said, well, she's my fur child, and she's my favorite. And there's definitely days I like my cats better than my kids. I come home and my cat's like, oh, mom's home, and I get some loves. Whereas I can hear my kids squabbling from sometimes outside my car door. And I just keep thinking, if I just, kept on driving, how far could I get before they realized I wasn't home? And I think about how important my cats are to me. And so I really want to kind of share what we know for current research, some novel products that are out there that will help us achieve that goal, that we go from these amazingly bred kittens to these perfect companions for their future families. And then finally, to kind of round out the evening, just to kind of touch base on some comments about pediatric spaying and neutering, and that cats really are not small dogs, as there's been quite a lot of differences medically in that area in our canine line. Oops. So first off, a little bit of background, just why are cats so awesome? So as I said, I love chocolate point Siamese. This really is my very classy cat. This is Utini. This is my favorite child, if you were to ask my children. So cats are quite unique for us. They came to us perfect. As I joke with my clients, if I was to regard cats as electronics, they're kind of like Apple products. You just turn that iPad on, it's pre-programmed, everything's wonderful about it. Whereas dogs are really like old school IBMs where you have to upload every program individually and hope you didn't crash the system. So cats already came to us as we transitioned from a hunter-gatherer society to an agricultural one. The cats came with us because the mice came with us. And then from there, every cat that has since existed as part of our lives is because at some point in that relationship development, someone said, that cat is awesome, whether it was social because it meowed at us, because it was cute. And that's how cats are. We didn't really breed them for that specific purpose, just to be amazing as they already were. They're absolutely perfect. And it's interesting because we can see that in their breed existence, it's a relatively short window of only about the last 150 years. One of the challenges of that is that cats don't actually need us. We describe them as an optionally social species. They do perfectly fine without people. I certainly could not live without them. And it's quite amazing how, if we did leave cats to forage for themselves, apart from maybe the sphinxes who are hairless, they can easily return to those feral ways. Cats are also an interesting this dynamic where we view them as these mighty predators, and they are for birds, mice, flies, but they're ultimately also prey for things larger than they are. And so when we look at their behavior, it's that struggle of being very predatory towards little things, but also some very kind of strong defensive mechanisms because they recognize that they do have that place as being prey. So we can see how these cats in our homes can have very strong predation drives. And that might show up with cats who are play aggressive towards people if they're not expecting it, or needing to like those high energies and outlets for that energy. They also need places to hide in case they are very nervous. And physiologically, we also see a very strong fear response, a lot of cortisol release when they are in those anxious situations towards novel stimuli. So in my mind, what is an ideal purebred cat? So I guess the first kind of goal I have is, does this cat exemplify the breed? Does it showcase what makes it awesome? And I could say we have lots of different breeds being bred here. So we want those Savannahs, those Bengals, those Maine Coons to really exemplify who they are. And I will just say, this is your area of expertise. I will just continue to admire and love these breeds and all of their unique characteristics, and advocate for their medical health, but for their cuteness, their breed awesomeness, I will bow to your expertise there. So one of the first things I want to see in an ideal purebred cat is good systemic health and free from known inherited and genetic conditions. And I can certainly make the argument how medicine has progressed over the last 15, 20 years since I've been in cat practice. And just wow, the tools that we have to screen, for example, in my career, we've seen Trichomonas fetus, which is a fecal diarrheal pathogen, come from being fairly newly discovered to discovered hard to test for. Now we have PCR testing for it. Now we have the ability to test for it relatively easily and potentially remove that from our catteries. And so among historically Bengal cats who are more prone to Trichomonas along with Giardia, we can screen and hopefully clear these diseases from our catteries. We also have better screening techniques. So, for example, in vet school, you get taught about polycystic kidney disease among, say, Persian and Himalayan lines. I have yet to see polycystic kidney disease in any of my bred Persians because we have those abilities to screen for them. And so I think the overall health of the breeds has come a long way with knowledge and that testing ability. So one kind of comment I will make is with regard to infectious diseases and catteries, well, what about herpes virus? And I want to touch a little bit further about herpes when it comes to socialization of kittens and why maybe we shouldn't fear it as much. And for me, herpes virus carrier status or a kitten coming from a cattery with herpes, to me, that's cat normalcy. Herpes virus is endemic in our world. Over 90% of cats are carriers for it. So for me, when I see cats with herpes, it is never a reflection of a cattery status. It just says, yep, you're working and breeding cats, and that's okay. And we can see that viral recrudescence or reactivation, in times of stress, which for kittens would mean that transition from the cattery to their new homes. So what about temperament? And this is what I really want to focus on because we have kind of got the disease aspect covered. We have, the breed standards kind of covered too. But, I guess for me, it is really all about personality. If I want a companion in my house, it has to match my personality needs for my home. So I have a very busy home. I have children. My kids love their cats. Certainly, if I had a cat that was very fearful of kids, that would be a very big personality mismatch. And if I have that mismatch, then that's where we see a lot of stress, not just on the cat, but also for the human companion too. I think we do have to acknowledge that different breeds bring very different personality or temperament characteristics. And so there is that goal of matching the right breed to the right person or the right family needs. And there's it's a little bit of an older study, but to highlight the importance of personality, we can look at, there was a 1990 study that showed, it was a study that asked, it was actually female caregivers, what made the best cat. So what was theoretically the best cat for them? And everything reflected on personality, how predictable they were in their behavior, how much they cuddled, how close they were to the owners, how they enjoyed being cuddled or patted or groomed, how clean they were. So were they using their litter boxes, and how much they liked people. And so it was an interesting kind of eye opener for me when I was making these slides that, although we are attracted to cat for their physical attributes, their colors, I love a pair of beautiful blue Siamese eyes, for example. Ultimately, though, if they don't have that winning personality to go along with those good looks, then they're not going to have that wonderful forever home. So when we look at selecting and breeding cats and kittens, what are the factors that kind of dictates temperament or personality, and how can we as breeders influence that? So how do we work within our catteries to kind of create these social, calm, people-centric cats? As you can see, this is a photo of my daughter, and she's holding Harry. He is probably one of my best clinic cats. He always looks like he's been scolded. That is his normal facial expression, but he loves belly rubs. He is just a wonderfully nice cat, and he puts up with my daughter and even lets her dress him up in costumes, as you'll see some photos later. So when it comes to the breeding scenario, there's kind of three big areas that we can focus on. So we've got the Tom, the Queen, and then our environment, which is kind of where we come in the most. So jumping right to the Tom, I kind of put here the Tom, fortune favors the bold. If we think about the role of the baby daddy in cat world, especially say in colonies or in feral cat situations, they pretty much only offer their genetics. They don't really stick around or have a very, very limited role in kitten rearing. So he's just going to contribute his DNA. What's interesting though is that the Tom does contribute genetics towards behavior. Historically, we called it the friendliness gene towards his offspring, and that changed to now be considered or called the boldness gene. And what they found, or what behavioralists found, is that Toms that had this boldness gene were generally considered more social towards people. Now, it's important to realize this has nothing to do with cat to cat interactions. This is only a cat to person interaction behavior. And what they theorize is that the gene itself doesn't make a cat want to be friendly towards a person. It's more that a cat that's bold will approach people in the wild, or if they're feral, will approach novelty, novel stimulus, which includes human interactions. And if those interactions are positive ones, where the cat's like, oh, that person gave me a snack, then I'm going to go back and reapproach them. And so what we're seeing is these kittens have an innate drive to be more interested in these social interactions. They're going to look at this novelty, and if those experiences, like say, have that positivity, they're going to be more social towards people. So the idea that if you're bold, you get a fortune, you get good fortune that comes with it. One of the challenges with this is that as of yet, there is no genetic test for the boldness gene. So if this is coming to my cattery situation, it's now strictly going to be an observational determination. Does this Tom consistently yield kittens, regardless of queen, that are more engaging towards novel stimuli, that are more curious, that are kind of being more bold or outgoing in their personalities? And if that's the case, then we're going to continue to want to breed to those Toms to hopefully kind of keep having that genetics passed down. So as I said, there is no genetic test, but what I will also kind of throw out there is I think a lot of our genetic testing comes from demand. So if this is something among the breeding community that's like, wow, a boldness gene or a test to determine boldness in my Toms sounds pretty amazing, then, if the demand is there, then hopefully someday we will have that genetic testing. So as of right now, it is simply an observational, but hopefully, we'll be there eventually and can genetically test for this. And as I alluded to, this is Harry dressed up in his gangster cat Halloween costume, because he's a really good boy. He is a very bold cat. So jumping to the queen. So the queen is a very interesting position in determining kitten temperament. She is contributing genetics. She's also providing us with the uterine environment that it's going to grow and nurture these kittens. She's the one that nurses them. She's the one that teaches these kittens as well, from their early behavioral aspect. And so we have not only genetics, but we also can talk about epigenetics as well. And epigenetics is this concept that my environment, that I have, my body has certain genes present, and then my environment influences if these genes get expressed or not. A very good human example of epigenetics, or that concept, is if we take up meditation. So if I start to meditate, then I'm going to turn on relaxing type genes. I'm going to turn off some of my cortisol stimulating genes. And there's about a 200 gene difference was the last time I read that meditation can achieve in producing that sense of calm and relaxation and stress reduction in our bodies. And so this is simply using my environment to turn certain genes on and off, which can then cause that physiologic response in the future. So one of the challenges that we do have is that epigenetics also means that gene expression within the queen can be influenced in the kittens. And so if we have parental fear, so if we have a queen who is, say, very fearful of people or other stimuli, then that might actually be passed on to those babies as well. And so our goal here would be selecting queens that are not only genetically healthy, but also that have strong emotional health or emotionally relaxed to kind of increase that social ability of the kittens and to influence their gene expression through epigenetics. So looking at queen nutrition, and I found this quite interesting because there's not a ton of research in this area, but there is a little bit that we can look at for how we feed the queen to influence our babies. Obesity, I did throw in there. It has absolutely nothing to do with personality, but I certainly can appreciate that obesity is an epidemic among our cat populations. Food tastes delicious, and we are seeing that weight gain as a result of that. So obese queens certainly can predispose for obese kittens. We also found that small litters will tend to have more kittens born in small litters can have an increased likelihood of obesity as well. So if I have a smaller litter, I might be more cautious with how I'm feeding them. And also premature uh, weaning will also influence obesity too. There's a theory among people that it's the hormone leptin in milk that can kind of set us up for that obesity, not obesity risk factors. And so kittens, if they're weaned before 8 weeks of age, could have that potential for obesity as well. Folic acid, we talk about supplementing in dogs to prevent cleft palate. This is not something proven in cats, and so I certainly would not be suggesting adding folic acid at this time, as there's no proof of benefit for our kittens. Taurine, interestingly enough, really can be important. And for catteries that may be experiencing early embryonic loss, potentially small litters, depending on what diets you're feeding, lack or deficiency of taurine might be a risk factor within the catteries that way. And I always find that quite interesting in the sense that back in the 80s, we appreciated the importance of taurine for cardiac and ocular development. So we saw retinal atrophy and dilated cardiomyopathies in adult cats who are deficient in taurine, but it also has an important role in embryonic and fetal health as well in development. One supplement that might be a benefit to the kittens is EPA and DHA. So these are essentially my fatty fish oils. In children, for example, who have ADHD, that's been shown in humans to improve focus and memory. So we do know these have an important role in cognitive or brain development. And in kittens, this can improve their learning ability, memory, and their vision as well. So ensuring appropriate levels of these omega fatty acids is going to be important. Certainly, one word of caution, depending on where I'm supplementing or sourcing my EPA and DHA, we do have to be very careful of vitamin A and D overdose, which is why, for example, I would never recommend cod liver supplements to my clients or my patients because of that potential risk for toxicity. So other kind of factors, as I alluded to, an obese queen will have obese kittens. One of the challenges, though, is, well, let's just not feed the queen as much food. Let's prevent that obesity. But if we undernourish the queen, that can also create developmental delays in our kittens. So it's striking a very kind of happy balance between enough calories in these baby mamas, these queens, to ensure appropriate kitten size and health. What was interesting in the malnourishment studies is that a malnourished queen passed that on to the kittens even when they were fostered onto non-food deprived foster queens. So that idea of striking a very perfect nutritional balance is quite important. With regards to kittens that were from queens that were malnourished, and again, these are coming more from fostering from shelter studies. these kittens tended to be more antisocial in their adulthood as well. So appropriate nutrition is going to be important there. And then finally, if we look at protein restriction, so picking a diet that has adequate protein, if I caused insufficient protein in my cats, then and this was important because it was, sorry, rest my thoughts here. If I fed the queen a protein deficient diet, and this included late stage of pregnancy into lactation, then we had delays in, say, kitten attachment, and some of their development as well, up to 12 days postpartum. So bottom line for queen nutrition for influencing their health, but as well as kitten um, kitten sociability is EPA DHA will help my cognitive health, obviously adequate taurine, adequate proteins for developmental health. Try and strike a happy balance with obesity prevention. But I appreciate that that is a lot to ask and more complicated than just here, feed this diet. So moving on from the queen, and this is probably the part that I'm most passionate about, it's handling these kittens. And this is kind of where I think we really come into play here. When I talk about Utini being my favorite child, so when I went to get her, so as I said at the beginning, I grew up with chocolate point Siamese. Not that I ever play favorites, but I really do love the breed. And I really wanted one for my own kids to experience and enjoy, and for myself too, because that's my favorite breed of cat. And I found a breeder. It was a fun road trip. My best friend, my head tech, and I, we hit the road. About 3 hours later, I laughed because there was one emergency pee in the ditch. One of our kids vomited in the car, and we did one wrong turn, and we ended up at this farm, and they were breeding mostly snowshoes. But I really wanted an all solid Siamese type, so she has a snowshoe background. She just doesn't have any of the white markings. And I remember coming to this very wonderfully clean cattery, and the woman in charge is like, "Okay, kids, the ladies are here. Look at the kittens. You know, you got to give them back." And they had about 4 kids. They were probably between the ages of 8 and 12. They're watching TV. It was on the weekend, and they're literally like pulling kittens out of every random pocket you could imagine. And then I picked my Utini and brought her home. And one of the comments that a lot of friends, colleagues have is that, wow, she's a very calm, very social cat. And I really appreciate now more than ever how amazing her socialization was, especially towards younger kids, because that's what my household has. And that's really helped influence who she is. So when's the important time? And this is where all of the work, right or wrong, falls to the catteries. We can now appreciate that that golden window of socialization, that real sensitive time window, is between 2 and 7 weeks. So this is where the kittens are still with their moms, they're still in our catteries, they haven't been weaned yet. This is where we have the most impact on overcoming whatever genetic and epigenetic influences may be in that kitten. So kind of like kittens have their base personalities. I'm sure you have all seen that. You know, in a litter of kittens, you have some that are hooligans from the get-go, breaking out, others that are more shy and reserved. So we have these innate genetics of who they are, what their personalities are, and it's up to us from that 2 to 7 week window of opportunity to imprint upon these kittens, to socialize them, to introduce them to novelty, so that we can hopefully overcome, those shyer ones can overcome some of that fear and be social, and maybe some of those little hooligans learn a few manners at the same time. So why is this so important? And it's pretty much down to the fact that these early life experiences will impact behavior into adulthood. So this is where those programs really do happen. What we know is if kittens are poorly socialized, they're going to be fearful. And if we have a fearful cat, it's going to become aggressive and potentially excessive grooming. So it may have some anxiety behaviors. Fearfulness will also have a cat that doesn't want to interact with their owner or will seek decreased interactions. So if I'm an owner who wants all those interactions and I want that cuddly cat, now I have a personality mismatch. It's going to cause me anxiety, and my forcing that relationship onto that cat is going to cause them a lot more anxiety as well, which may manifest as aggression. To further that, cats are very scent-based communicators. I often joke among clients that if I was to describe a cat as a personality, they'd be that passive-aggressive coworker who puts up, the snarky messages on the bulletin board about not washing their dishes, rather than directly confront and tell us how we're feeling. They want to avoid direct confrontation, and so a cat solution is not obviously to put up a notice on the bulletin board, but to pee on something. So I'm going to inappropriately eliminate, usually with urine, to try and convey that message that your behavior is stressing me out. I'm full of cortisol. I'm very stressed. And so we end up with these cats who may not be using their litter boxes, that are fearful. They may be having aggressive tendencies because they don't know how else to manifest that fear. And these are the cats that will be returned to shelters. These are the ones that usually have a higher likelihood of being euthanized, or potentially returned to catteries if that's an option. And that's not what I think anyone here wants to see happen. So how do we socialize kittens? And so this is, again, here's my daughter, and this is my hairless guy, Zeb. I do love Sphinxies. He also has blue eyes, so I got the best of both worlds with him. There's a funny story as to why I do have Sphinx. When I first met my husband, I was like, "Hey, can I get a cat?" And he was like, "Sure." I was like, "Maybe we can get 2 cats," and he said, "Okay." And then he was like, "You're a cat specialist. You should have hairless cats." And I was like, "Well, I'm a veterinarian. We also adopt cats as well." And there's a wonderful Sphinx spay neuter rescue in the province, and I was able to both rescue and get hairless cats at the same time. And so these are my cool guy. And as you can kind of see in the picture, so my daughter loves the cats. It is definitely more of a one-sided relationship. As I keep telling her, she needs to be calmer. She needs to, let them come to her. I mean, kind of see these 2 pictures here, how on the one where it says on the, I guess, my right, where she's on the hardwood floor, you can just see that cat, he wants to escape. Whereas when she's in her pink fuzzy jammies and he's wrapped up in his fuzzy blankie, everyone's chill and everyone's happy. That's a very good social interaction. And so this is where it's not just introducing these litters, these kittens, to novel people, to novel stimuli, different litters, different foods, different sounds. It's introducing them in such a way that these kittens recognize that these are not scary situations, that these children are okay, they're not going to harm me. And so it's really focusing on making these very positive social experiences. And that's also kind of where we do have to see that interaction happening. Exposure is not the same as a socialization interaction. So I can put novel toys, novel foods in a room with kittens, but unless they're actively engaging with these items, they're not going to become socialized to them. I kind of looked at this first picture and it makes me kind of think of those old Tiny Toon commercials with, or Tiny Toon cartoons, I should say, with Elmira, where it's like, I'm going to love you and squeeze you and hug you and cuddle you. And all you see these animals desperate to get away. So that is the very opposite of what we want to achieve with our socialization. So one of the challenges I think we can appreciate is we want to protect these kittens. They are going to be at a vulnerable age. This is that 2 to 7 week window. We're going to be at that period of time where maternal antibodies from colostrum milk are going to be wearing out. For conveying maternal immunity, they're going to still see viral neutralization from vaccinations. So how do we prevent them from getting sick? And so I really do understand that fine balance between infectious disease control and certain exposure to novelty stimuli. I will say that fear of infection should not determine our actions. What we found with post-COVID baby studies was that essentially babies born during COVID, where they didn't have those social interactions, we're seeing developmental delays in social communication. And so as much as we strove as a society to protect this very vulnerable group, we actually did do some developmental harm. And I think it'll take years before we actually figure out the full extent of it. So in my own practice, I have cats and I work with cats every day. I work with cats that may have a variety of infectious diseases, from herpes, calicivirus, flu, FIV as well, along with a whole bunch of, plethora of diarrheal pathogens. And I have very little fear that I'm going to bring some of that stuff home. I'm going to do very routine precautions. I make sure I wash my hands. I have my lab coats. I'm going to change my clothing. So the likelihood of me bringing something into my own home is very limited. Herpes, I would say, coming back to it, is probably one of the biggest challenging viruses that we have. We know that most cats are carriers for it, and much like cold sores in people, herpes virus has that magical ability to reactivate. We call it viral recrudescence when we're in a stressful situation. And so it's this challenge that if I expose the queen, if my queen is a carrier and I expose her to a very stressful situation, there's a chance that the virus will reactivate in her, and now she becomes my active shedder, which will then pass on to the kittens. And so it's striking that balance to ensure that the queen is not in an anxious position when we are socializing the kittens. And that can be through ensuring, she's eating lots of treats, lots of snacks. Is it easier to remove some of the kittens from her to limit her stress with novel people? That's listening to what your queen wants to tell you. I don't necessarily have a set plan that way, but I'm going to focus on keeping her as stress free as possible. And yet, like this, because I really want to socialize those kittens. My one comment at the bottom, what about probiotic supplement? So probiotics versus lysine. Years ago, lysine was kind of our go-to addition to cat food to help prevent or reduce viral shedding in herpes positive cats. The challenge with lysine is you have to give enough of it in a meal at a given time, which I want to say is 500 milligrams twice a day to an adult queen or to an adult sized cat. And so that little kind of sprinkling that we would historically do on the cat food probably wasn't enough. There's been some great research with probiotic studies. Fortiflora, the Enterococcus faecium, has the most research to back it up. And, it's really, I love probiotics. It's such an amazing realm of science where, we really are at the mercy of our gut flora. And so this is pretty much where I can take a probiotic and it will work the gut, my immune system at the gut level to make me hardier and more resistant towards infectious disease. And the neat aspect there is, unlike traditional medication, it's going to be safe in that lactating queen as well. So hopefully through this, I now have these perfectly socialized little kittens. I'm going to send them out into their new homes. And what's going to happen? They're going to interact with people, interact with other cats, or interact with people who have cat allergies. And so, as this is where, as a veterinarian, kind of, I usually will pick up that part of the care. And I want to talk about some novel products that have come out that have really been game changers in my world. They didn't get as much attention, I don't think. They all kind of came out during COVID, and they have been really amazing in my little cat world. I really did have to laugh that 2 of the 3 are Purina-based products. That was entirely by accident. I very much appreciate that Purina sponsored this talk, or that Purrfect sponsored this talk, but it doesn't guide me with what my recommendations are. So I love these products. They are quite amazing. So the first one is Purina Calming Care. So this is a probiotic. For anyone familiar with Fortiflora, it comes in the same cute little box, the same kind of liver beef bouillon kind of flavoring agent. This is a bifidobacterium. And what it is working at the gut level to reduce cortisol release. And you might think that sounds absolutely crazy. Like I alluded to, like the gut flora, there's a lot of unknowns with that. It's actually a huge part of our immune system, our digestion. We see a lot of connections now between gut and brain axis, gut and kidney health as well. So absolutely, if my gut flora is healthier and it has that potential to reduce anxiety, and I have both staff and clients who swear by this. In fact, I actually just rechecked a post-adoption kitty who's been on this for a couple of months. And before in the clinic where visits would be very stressful, nail trims were very, very stressful. He was a completely different cat. Still wasn't impressed that he was at the clinic, but his handleability, his tolerance towards those nail trims was night and day. And this is the only thing we've done different. So I was really, really excited to see that. Other kind of neat things, this is not a drug. There would be no contraindications. We could certainly introduce this to our queens. Toms as well, and potentially kittens if they were to kind of, if it was mixed in cat food, they were to ingest it. The only downside I would say is that it isn't an instant miracle. So because we are altering with our affecting gut flora, it can take up to 6 to 8 weeks before full effect. My response there is it sometimes works faster. Don't be discouraged. And when I tell my clients is, trial it for the 2 months. If it works, it'll keep working fantastic. If it's not going to work, it's not the therapy for them. So the second product I wanted to talk about is Feel Away Optimum. So again, for those familiar with Feel Away, the original or the Feel Away Classic was facial pheromone 4. So cats do their cheek rubbing. Now this is mine, that is mine. So that was just one pheromone. Then about 6, 7 years ago, we ended up with Feel Away Friends, which is a mammary pheromone. So this was meant to be more of one that I like how they're cats. And then came out and then since pulled off the market was a Fila scratched for to try and encourage appropriate scratching on desirable surfaces, not on the carpeting. So one of the challenges with pheromones, one of the appreciations is that there's multiple different pheromones out there and they all have a different response in the body. So kind of like how my Feel Away Classic, that's for my environmental happiness. So the happier I am, the more I cheek rub, the happier I am in my environment. So that's going to help with making, my new home just smell more calm, more relaxing, more inviting. Then we have the mammary pheromones, and these are where we look at this group of pheromones that are harmony pheromones. These are the ones that would help me make me like other cats. And then finally, we have the territorial messages, so the cat scratching ones. And so cats have these like multiple pheromone kind of communicated messages. So what Optimum tried to do is instead of having Feel a Friends, Classic, Foot Pad, they kind of mix it all together into one little happy packaging. So the goal that if I bring into a kitten into a brand new home where potentially there's other cats as well, then we're going to work on creating that very happy environment through those facial pheromones, but also hopefully encourage harmony among other kind of members of the household through those mammary pheromones at the same time. So it's just a little more potent, a little more complete than the traditional pheromone products. And then the last one I want to talk about, which really is exciting, is the Live Clear diet. I was really blessed to be able to hear the human allergenist that actually developed this food. When I first heard it discussed, I was like, this is like Harry Potter-ish kind of wizardry. It's pretty much, I want you to feed your cat or feed a cat. So we're going to feed species A to elicit a medical response, which is lack of allergies, in species B. This is kind of very groundbreaking. There is not any other product that I'm aware of on the market that works in the same kind of fashion. So how does this diet actually work? So here's the crazy story. So we know that when people have cat allergies, they're allergic to FeLD1 in feline saliva. So when cats groom, when they kind of spread their saliva in the environment, FeLD1 aerosolizes, and that's what makes me allergic to my cats. FeLD1 is important for communication, so we don't actually know 100% what it does. We just know that, for example, cats that are more stressed will release more FeLD1 than cats who are less stressed. So probably like everything else in a cat's world, they're very olfactory, they're very scent driven in their communication messages. So they might be trying to say, hey, I'm more stressed, hey, I'm less stressed. We don't know what, but there's kind of coming into that scent pathway concept. When we consider cats that are hypoallergenic, ultimately they're just low FeLD1 shedders compared to other cats. And that's what makes, within some of the species lines, or the breed lines, I should say, that's what makes a hypoallergenic cat. They're just low FeLD1 shedders. So here's the craziest of fun facts. If you raise chickens near cats, the chickens also become allergic to cats, to that FeLD1 enzyme in particular. Now, Mother Nature is so incredibly smart. And if we think about with mammals, we have colostrum milk. So in that first milk, all of my antibodies are going to be packed into that colostrum milk. So in that initial postpartum phase, that first set of nursing, then my gut, which is still not quite fully sealed up or mature, is going to absorb all of those immunoglobulins from that first milk. And that's what creates our maternal antibodies or maternal immune system. Now, obviously, with chickens, there's no colostrum involved. These chickens hatch from these eggs. And so, what Mother Nature has done is she packs all of those initial important immunoglobulins, all that maternal antibody goodness, in the egg protein itself. So, when chicks hatch, they've absorbed from that egg protein these maternal antibodies, which also happens to include FeLD1 antibodies if those chickens are still allergic to cats. So, from a diet perspective, this is where it gets fun. If you feed those cats that FeLD1 rich antibody from those chicken eggs and that chicken protein, it's going to bind salivary FeLD1. And bound salivary FeLD1 is now too heavy to kind of trigger that immune response. So, once it's bound, it kind of knocks it out from an allergenistic perspective. And so at the end of the day, you can have all the FeLD1 you want in the environment. It's bound, it's too heavy for us as the human to breathe it in to then have allergic response. So pretty much feed this magical diet and you will be less allergic to your cat. So does it actually work or is it all hook'em? So this is where the human allergenist who did the initial studies, who was a hilarious speaker, and his insight was pretty amazing. So when they did trial the diet, the first they had to have were people that were truly allergic to cats, not just psychologically allergic to cats. And once they had their test group, then they also had to find individuals who were sensitive enough in their cat allergies that they could discern different levels of FeLD1 in the environment to prove that if we lowered FeLD1, that you were less likely to trigger an allergic reaction. So I always think of it as, one cat I'm fine, 3 cats I'm sneezing, 10 cats I can't breathe. And that was kind of how the research came about. And it was pretty groundbreaking. And I was very excited when preparing these slides to realize that there's now a kitten version. I only knew the adult diet. So yay, now it could potentially be feeding this right from the get-go. So very, very excited about that. And so finally, because I realize I'm running out of time here, is just the last little bit on pediatric stays and neutering. Pretty much cats are not small dogs. Cats rule, dogs drool. All the reasons why we are looking at doing delayed staying and neutering in dog land, such as arthritis prevention, cancer prevention, not proven in cats yet. And so early sterilization is absolutely still endorsed by like the American Association of Feline Practitioners, shelter groups as well, because delaying that is not going to impact arthritis development. It's not going to impact urethral size from crystals and stones and urethral blockage. And certainly, so if that is something that you as a breeder wish to continue to do, then certainly there is no medical reasoning why you should not. And so that comes to the end of my part. I will now pass it back to our wonderful media moderator for questions.
Dr. Liz, thank you. That was so interesting. Thank you so much for highlighting Live Clear, because we're also trying to get the word out about that great formula. I liked how you had information there for all levels of experience. So we really appreciate you taking the time to share your thoughts with us. Thanks again. Now, for everyone else, don't go anywhere yet, because we still have some question and answers that we want to take care of. But before that, I'm going to take a few minutes, I promise just a couple, to highlight a few more veterinarian recommended ProPlan cat food products that are popular with breeders, as well as tell you a bit about our breeder program. Next slide, please. Great. So the kitten formulas obviously are very popular with our breeders, also suitable for queens during all the stages of reproduction. They're high in DHA, high protein at 42%, omegas 3 and 6, calcium, and includes live probiotics as well. This product graduates into the adult formulas, the Complete Essentials lineup, which is a great everyday formula and comes in several proteins options as well. The indoor formula, which is the indoor hairball formula shown here, is great for the long hair breeds. It includes natural fiber, which helps control hairballs, And the high protein maintains lean muscle and healthy weight for breeds that tend to put on weight more easily. And finally, urinary, which is often recommended for intact males. Low dietary magnesium, which reduces urinary pH. So ProPlan is sold through specialty pet stores like PetSmart, Wren's, Pet Value, local farm and feed stores, as well as online retailers. Next slide. Thank you. If you're interested in trying ProPlan, consider signing up for Pro Club, which is our loyalty program for breeders. The benefits include savings on everyday purchase of ProPlan through an easy online rebates, free delivery for large purchases, which we currently only have available in Ontario. We have great breeder kitten kits with a full bag of kitten food and 3 wet kitten cans. It's not the sample bag, so you actually get a whole bag to send home with your kittens, which is wonderful. So if you've registered for this when you registered for this webinar, if you signed up to hear more from a I get tongue-tied with that one, ProPlan breeder representative, that would be me, Bernice Lacey. I'll follow up with you sometime this week, so look out for my email. I've been with Purina for 18 years now, so I should be able to answer any of your questions about ProPlan. If I can't, I will certainly find someone who can get the answers for you. If you want to learn more, please visit us at purina.ca/ProClub. We're going to have some question and answers now with Dr. Liz. Just a reminder, if you want to ask something, put it in the Q&A box. And then we'll have a look at here and we'll see. So the first question we have, how common are fungal infections in cats? In Alberta, possibly?
Yeah, so that's a great question. So I'm going to say it's very regional specific. And Alberta is we're technically a desert climate here. So we're cold, we're dry, which means that we tend not to have the parasite or the fungal burden that other areas do. So I guess I would certainly talk to you're like Ontario, BC, so more humid climates are going to be more at risk than I am. So short answer is very regional, and thankfully something I don't deal with too often. When we have dealt with fungal such as ringworm, it's interesting if that's specifically the fungal, like the dermatophytes, like ringworm is what the question's being addressed to. You know, it's very sporadic. I'll go years without seeing it, then I might have a couple of cases. You know, historically, we were also seeing it in daycare and in our world out in Alberta, some of the oil rig camps as well were actually potential hotspots for fungal infection, more so than the cats within our homes. One of the challenges I will say with cats is they can be asymptomatic carriers for the dermatophytes. So that is certainly where even if my cat does not have lesions, if I'm seeing potentially kittens having outbreaks or sending kittens to to a home situation where you're seeing outbreaks happen, it might be worth to check the adults within the home, even though they're lesion free, because cats really can be those asymptomatic carriers. It's also for that reason, if we do have a positive cat, we're going to want to treat them systemically and not just topically, because you want to try and clear that carrier status.
Perfect. Okay. This one's from Matthew. What would your advice be for first-time Bengal-specific breeders?
So I guess my advice is always to reach out to other members of the Bengal community. If it's with regards to socialization in particular, and I'm actually going to throw this out, regardless of breed, I've been blessed to have a pretty amazing Bengal breeder. We've been with them since the beginning. They've actually just retired. They're Tom now and are moving on to their next great adventure. And they are probably the most social Bengals I've ever had the privilege of caring for. And their big thing is they also had children at the same time, and their kids have been from about 10 to 18, like over that 10-year period, And I think that really does go a long way for improving that socialization of that breed. Like they're very high energy. Having people aware of that energy status with them too. If you're talking more about the disease aspect to it, I mean, historically, like I alluded to, Trichomonas fetus and Giardia are the two, and probably more so Trichomonas now would be the one kind of diarrheal pathogen that can potentially sneak into the Bengal catteries. They seem to be a little more at risk for developing that form of diarrhea. So it'd be making sure that if I was bringing in a new queen or a new tom, that I'm going to run a diarrhea PCR to screen for them to ensure I'm not bringing that pathogen into my cattery situation.
Okay, great. And this is from Carol. Is there a general standard about how many litters a healthy queen should be allowed to have, or is it on a case by case basis?
So, really good question. And I would argue that there is certainly a case by case aspect to it. For me, the biggest thing is ensuring that the queen is sufficient nutritional health. Her body conditions come back to be able to properly have a very successful pregnancy. So in that case, if I had a queen who tends to lose a lot more weight during that lactation phase, then I might delay breeding her on like the next heat cycle or several heat cycles until her body condition came back up again. If I had another queen who bounced back, then I might elect to breed more often. So I think there is certainly a case by case aspect to it. But for me, it's really focusing on ensuring that wonderful body condition that they have the appropriate body fat proteins to have a successful pregnancy.
Right. From Florence, what are your thoughts regarding fish oils, primarily the most common salmon versus herring oils as a supplement?
So with fish oils, so it's a great question. I'd have to say I'd be looking at the label. I'm just going to avoid the ones that have for the vitamin A and the vitamin D toxicosis. I want to say salmon oil in that sense over herring. If I last time I checked, I do know some companies will have EPA, DHA specific oils as well. My one kind of challenge, or I guess my general comment I'll say about supplementation is, that's where I would want to be reaching out to a nutritionist or selecting diets that already have them included, because I know I'm not going to be hitting with those toxic levels of vitamin A or vitamin D. Whereas a supplementation, I potentially run into that risk. If this is adding to, say, a homemade diet or raw diet, then yeah, watching the vitamin A and the vitamin D, my fat soluble vitamins, which I then will be leaning more towards the salmon oils in that sense. But I would say, whenever in doubt, reach out to a veterinary nutritionist. They can help formulate a recipe.
For sure, for sure. Rhonda's asking, what do you think of a raw diet for my Bengals? And if they're on a raw diet, is it safe to feed them fresh hunted meat like grouse or fresh caught fish?
So I always say I have a bit of a love-hate relationship with raw diets. I recognize cats as obligate carnivores. They're out hunting. They're hunting birds. They're hunting mice. They're hunting bugs. That is what they are physiologically geared towards eating. And it's not like I'm going to be releasing, 6 to 8 mice in my house every day for my cat to hunt and devour. So raw food has that advantage of being maybe a little bit closer to what my cats are hunting. The challenge I have with raw food is both the safety and the nutritional balance of it. Safety is in handling a raw food product. I know both of my kids went through a cat food eating phase of their lives, and so certainly I wouldn't have raw in that situation where my kids might just accidentally ingest it, or cats that are on raw diet tend to have more fecal pathogens. They're grooming themselves, they're grooming my kids or licking my kids' faces, and then even after a pandemic, my kids still don't know how to wash their hands properly, no matter how much I've tried to explain that to them. So from that safety aspect, I wouldn't have it in my own home. And then, as I said, the other challenge is going to be nutritional balance. We're going to see a little bit more batch to batch variability behind it. Now, that said, I have absolutely seen cats that have thrived on raw diets where they have great fecal health on them. So I think when we look at nutrition, when we look at diets, and I can even, make this comparison to people, like, what we now know is a lot of our response to individual diets is going to come from what my gut flora is. That's actually probably a bigger driver for optimization of health. And so if I have a cat that thrives on the raw diet, then awesome, I'm going to keep feeding it. If I have a cat that I try it and it's not the right food for them, it doesn't mean that the raw food is the wrong diet. It's just not right for their physiology, for their gut flora, for their genetics, epigenetics, all of that. It's just not for that individual. As for your comment about kind of fresh, feeding kind of fresh game and fresh meats and that, for me, it always comes down to handling and safety. So if I'm confident in my handling and safety, then it'd be very comparable to the raw diets. But if I'm not confident in my handling and safety of it, then I would probably avoid it.
I'm not sure if I'm going to read this properly here, but different blood groups, Queen equals B, Tom equals A/AB. Is it dangerous or is there a solution? Did I read that right?
Yeah, so, oh
Okay.
gosh, this is going to, I knew I should have read up on my blood groups again. So yeah, it's cats have A and B because it's the issue is with like colostrum milk. If you feed it to the wrong group, for example, you can have the uh, neonatal isoerythrolysis of that. What I can say is, let me put together a better answer on the blood groupings of cats. It's not, funny enough, it's probably not as much of a challenge in the sense that like breed groups tend to have their same blood types together. So if that's okay, if Breeze can email me that question, I can email a more appropriate answer of where we're at with that, with the blood typing.
Okay, that was from Riam. Thank you. This is from Stephanie. What is the best age to spay a kitten or neuter a male kitten? I've heard some breeders are doing it at 4 months.
So if we think of the shelter group philosophies, and part of the reason for the pediatric spay neuter programs among shelter groups is that desire that every is population control among stray cats, and so everyone leaving the shelter was going to be spay and neutered. And in those cases, it's a goal of a 2 pound body weight or 1 kilo, which is roughly about 8 to 12 weeks, usually around the 12-week mark, is when most shelter groups are spaying and neutering. I know when I went through school, we kind of got taught 5 to 6 months or 5 pound body weight. With the biggest challenge we're going to have when we start to look into pediatric spays and neuters is potentially hypoglycemia. So these kittens are more prone to lower blood sugar levels, as well as hypothermia under surgery. So one of the things in my practice is I have no qualms spaying and neutering at 12 weeks. We're going to modify our fasting protocol. So I would not fast a 12-week-old kitten the same way I would fast an adult cat, where overnight is fine. But in those little kittens, it's pretty much, we're removing food sources at the time they're going to come to the clinic. So it's a much shorter fasting window. With addressing, say, the hypothermia risk, since I know that's going to be a problem, we're going to work on just ensuring passive warming of these kittens through just our surgical kind of techniques. So I wouldn't say it's necessarily an age aspect so much as a body weight aspect, and certainly up to like 2 kilos is just, or sorry, 1 kilo or 2 pounds is kind of been the accepted cutoff. And we can kind of go up older than that, absolutely. My big thing is certainly spaying and neutering for the queens or the females before first heat cycle. If we spay before that first heat cycle, we bring the risk of mammary carcinoma down to near zero. And in the case of the boy kitties, right or wrong, neuter them so that there's before any kind of manly boy thoughts happen. Testosterone is a very potential for aggression, but also spraying. And I just want to lessen that risk in the new home.
Here's one about ProPlan. Are there any alternatives for cats who are allergic to chicken? This is from Charlene. So Charlene, if you just want to write into us, we'd be happy to give you some suggestions with our different diets for you. That's not a problem.
I will jump in and say I'm pretty sure Live Clear, if that's the address, does have a salmon version. I think they do.
Good. Okay. Ashley's asking, do you find the bold gene cause the tomcats to be more irritated by other cats?
So no, so the boldness gene really only impacts, like I said, that cat to human interaction. It will have no impact on cat to cat interaction. And certainly I can argue that, intact toms, they're territorial, they love their ladies, they don't like other cats, the boy cats potentially. So the boldness gene isn't going to interact with how they view other cats. It just strictly reflects that curiosity and acceptance towards people.
I'm just gonna. And Catherine is asking, is giving birth stressful enough to reactivate the herpes virus?
That's a great question. I think if I had a nervous enough mom, absolutely. I mean, I am a mom, like giving birth is a pretty big deal. So part of the things that they would recommend would be in a cattery situation, having the queen in her nesting box, prior to up to several weeks before her delivery date, ensuring that she's not moved, that she has that appropriate kind of nesting area that she's happy with in that medium postpartum time, trying to do everything we can to make it less stressful on her. So, I think it is physiologically going to be stressful. We're going to do the best we can to prevent that. Hopefully, though, even if she were to have reactivated of the herpes virus, she's going to be passing on that colostrum milk to those babies, and they're going to gain that maternal immunity from her anyway to lessen their chance of virus contracting the virus.
Britt Ann is wondering about what you said about the herpes virus again and how 90% of cats have herpes. She was under the impression that the FVR vaccine is for that. And can you explain a little bit more about the herpes so she can understand that
For
part?
sure. So feline herpes virus, as I said, is endemic in cat world. We estimate over 90% of cats are carriers for it. And the challenge is that most cats or kittens are going to pick it up from their mom, just or that let's say it was a shelter situation where we have that waning of maternal antibodies, but the vaccination still doesn't quite work. They have almost like enough maternal immunity to neutralize the vaccine, but not enough to prevent infection. And that's typically when most kittens catch those colds, they have the runny eyes, the sneezes, the runny noses. When I was in school, we got taught then that the virus, they clear the infection, boom, it's gone. And if they got sick again in the future, it's a new strain or a new exposure. And now we appreciate that no, it actually is reactivation of the virus. So the way I explain it to clients is the RCP vaccine, which does absolutely contain a herpes component. I try to think of it being a little more comparable to a shingles vaccine in people. Shingles, which is caused by, which is also caused by the chickenpox virus. The chickenpox virus is ultimately a herpes virus as well. And so in our later years, we receive shingles vaccines to hopefully lessen virus reactivation, lessen the severity of infection kind of moving forward. So it doesn't mean that the vaccinations aren't still important. It's just that once we're in that kind of carrier status, that we can't clear the virus from the system. So our goal then becomes lessening severity of flare-ups, hopefully not having flare-ups happen.
Christine wants to know what is the best replacement for queen's milk?
Another queen. No, I'm just well, I'm kidding, but not really kidding. So beer's wonderful. So just kitten milk replacer. I want to say KMR is probably the one that's been the most consistently available. When I've used that for say orphan kittens, or for supplemental feeding, that just make sure we add enough water to it since it seems to be very pro-constipating and fairly high calories. So I want to say KMR. If you do need milk replacer, let's say you have kittens where the mom has passed away, there's an orphan situation. Even trying to introduce those kittens to another queen, to some litter mates, is going to be helpful for their socialization. Moms have an amazing role in teaching and caring for the young. So supplementation is going to be helpful, but still keeping with that mama.
Natalie would like to know, what do you think of a dry and raw nutrition for queen that is feeding their babies at the same
Uh, So is that the sense of like with the raw food, like the queen being fed the raw food from like fecal shedding? Is that what the question would be, or
What do you think of dry and raw nutrition?
I guess my goal with
Participate?
any nutrition of the queen is going to be ensuring she has adequate calories
Yeah,
and adequate micronutrients, so they get enough calcium, fats, protein. So my macronutrients, so my fats, my proteins, or the milk, and then obviously the micronutrients and the calcium, especially in that. So I guess so long as the raw food is accomplishing that, is still nutritionally balanced and giving her adequate calories,
that's how I'm
then
reading it, more like a balanced. Make sure it's
yeah.
balanced and okay. And Britann is asking another one. If mother isn't showing signs of stress to reactivate herpes, how would the kittens pick it up?
So So I mean, I guess it depends on who else is in the like if the kittens are separated from the queen, or sorry, if the kittens and the queen are kind of kept separated from other cats and there's no other one to introduce viral reactivation, then the risk towards the kittens picking up that virus would be very minimal. I guess if we have those windows where either there's other cats being exposed to them within the cattery situation, so I guess it would depend on my housing at that point, how I'm keeping cats separated from each other. I guess is it hard to prove who is or is not shedding virus? It's like we have say PCR testing to like do conjunctival swabs, nasal swabs, and what's frustrating is that even when you have a cat that has every evidence of a herpes infection from like the dry crusty noses or the ocular discharge, picking up positive PCRs are still pretty hard. So I guess even in an asymptomatic queen, could she still be shedding enough to pass on to the kittens? That's a great question. I don't know that answer. I would argue, though, I think if I'm reading the question right or interpreting it right, it's more, is it just my queen, just that kitten in isolation, or is there that point in time where there's potential introduction of other cats within the cattery situation? They could be our source of infection as well.
Exactly. Now, Vera is asking, pediatric castration is a key to prevent cat overpopulation, but it's very slowly accepted in Canada. Do you know why?
Uh, I don't that's a great question because I mean now that we see the AFP endorse it and like the shelter groups endorsing it, certainly again, not that I want to say I'm an old veterinarian, but I obviously have, been in this industry for about 20 years now from my undergrad to the veterinary to being a veterinarian. And I remember when the Calgary Humane Society introduced the pediatric spades and neuters, it was quite groundbreaking at the time. And that would have been about 18, 20 years ago now, which means that time flies when you're having fun and getting into lots of trouble. So I think once we see more shelter groups endorse it, then veterinarians are going to endorse it as well. I think it's also a generational aspect with veterinarians too. Again, it wasn't something that I was taught, but it is certainly something that we're seeing taught and advocated for in the vet schools too. So I think as we see, you know, newer veterinarians that come on board with that knowledge, come into practice and start to find their voices, we might see it more readily accepted. But if this is something that you as a breeder are passionate for, then advocate for it as well. So it is, I said, it's coming there. It is maybe a bit slow, but I have seen the shift happen, and we'll get there.
Okay. How do you avoid weaning diarrhea in kittens?
So slow transition with food. Uh, Certainly small micro meals as well. Probiotic therapy would be something to consider at the same time. So I think everyone faces that challenge. It's minimizing their stress. It's still having mom present, but we do seem to see that smaller, more frequent meals seems to be one very easy thing we can do to lessen eating diarrhea.
What do you think about grain-free diets or kibble for cats? And Stephanie has seen a lot of them at her pet stores.
Yeah, so I always say when it comes to nutrition and right or wrong, this is my own philosophy. I mean, I see the passion behind how we feed ourselves. Whether it comes to keto diets or gluten free or this and that diet. Nutrition is a very passionate topic, and how we feed our cats, part of it is that projection of what they are, my family. So if I choose to eat grain free or carb free in my diet, then is there that aspect of projection of my needs onto my cats? In dog world, certainly we are seeing potential concerns for cardiomyopathies on the grain free and the legume rich diets. They are suspecting it might be due to taurine levels. We haven't seen that happen in cats, and the most likely reason being that cat diets are very readily supplemented to ensure adequate taurine levels. So we've potentially avoided that challenge. I know one of my own cats did absolutely have a grain sensitivity, and he thrived on, a soy-based hypoallergenic diet that was the right one for him and for his GI issues. So, I, yeah, like I said, right or wrong, like I find that, caregivers will feed to what they're passionate for. And so long as that diet is achieving a healthy coat, healthy stools, ideal weight, good urinary health, so not seeing crystals, not seeing stones, and we're feeling well on that diet and thriving, then I'm happy to feed that. If I'm not meeting that criteria, then that isn't the right diet for that individual cat. And we can appreciate with nutrition, there's a lot more subtle nuances. Like I say, gut flora and the biome has a much bigger role than we appreciate. We're only scratching the surface there in that aspect of research in cat world. So potentially, this might have a lot more information in the next few years. One of the ways the things that I'll just kind of throw out there, which does get asked a lot, is like, what are my thoughts on, say, byproduct in food? And I have this vision, when a cat hunts a bird or hunts a mouse. Let's say it's caught this bird. It's not like it puts on a little napkin, grabs its knife and fork, and deliciously, eats the breast meat first, or just grabs those little thighs, yum yum yum. No, like cats actually go for the entrails first. Like cats to me love byproduct. They like the organs, they like the guts. So certainly, I guess I care less about grain free when people ask me about my thoughts on byproduct. That's kind of the visual I present to them, which is why I have no qualms about it. And that organ meat is what cats actually love to and thrive on. But ultimately, yeah, like with the grain free, like I said, there's a lot of passion around nutrition. I just want the cats to be healthy and thriving. If the diet's meeting those objectives, I'm happy.
Perfect. How do you know when it's time to retire a queen?
Oh, so most times, like if we're looking just at chronological age, usually that kind of middle-age status, so 6 to 8, usually closer to say 6 or 7, is when I see most of my breeders retiring their queens. I think it's very multifactorial. Some cats are, some queens love to be moms. Like others, can't abandon them soon enough. They're not have those maternal instincts. So I think the idea of when to retire a queen partly reflects her thriftiness, her ability to bounce back from a pregnancy. How is she as a queen? And this also then kind of comes back to what genetic influences does she have? She might be the most beautiful queen in the whole wide world, but if her kittens are not social, not wonderful companions, kind of moving forward, then that might be a queen I might seek to retire much sooner, as opposed to a queen that has amazing social babies. You want to kind of keep those genetics going. But I would say that from a chronological age perspective, usually around that 6, 7 year mark is when we really want to have that conversation. And if I think about that as comparable ages, that's like us hitting our kind of early 40s, which is where that, I'm happy I had my kids in my 30s. If someone told me I was pregnant tomorrow, I would probably cry.
Okay. I have a couple questions from two different people here, and I know this word is going to trip me up, so I'm going to try it. You'll know exactly what I'm talking about, but is there a simple way to eliminate
Trichomonas
Yeah, that's
fetus.
it. And maybe a special diet plays a role besides antibiotics?
Yeah, so trichomonas fetus, I empathize. It is absolutely the bane even of my existence. As of yet, the only drug option we have available is ranitidine, which was a turkey-based antibiotic, and I've had failure to clear Tritric even using that. We can sometimes have success with increasing fiber in diets, but I wish I could offer a much better answer than that, except that if you're battling Tritric, I am very, very sorry to hear that, because certainly I've seen treatment failure, and it's I empathize with your frustration. I really do wish I could offer a more magical solution than that. With Tritric, though, I guess the only silver lining, which is kind of historically what we saw too, is a lot of cats will outgrow it at around the 2 to 3 year mark. So their diarrhea almost self-resolves. They probably enter a carrier status with it. But I guess that would be my only kind of hope, is we can see that kind of spontaneous resolution. But ultimately, no, at this point, we still only have ranitidine as a means of clearing it, and even that's not successful.
Okay. Is there a test for determining whether a queen or a stud carries the HCM gene? And your thoughts on maybe having it done, the scan done by a cardiologist?
Okay. So with HCM, so the challenge, so hypertrophic cardiomyopathy, so cardiomyopathy. So the challenge with HCM is that there's multiple point mutations that can trigger HCM development clinically. And so when we have genetic tests like for ragdolls, Maine Coons that are developed, they're looking at identifying the most common HCM mutations within those breed lines. So in that case, positive says that yes, I have a genetic mutation. A negative doesn't mean I don't have that risk of HCM development, because there could be another point mutation within that genome. And that's what makes genetic testing in itself a little bit tricky, because if I'm only looking for specific mutations, I might miss some other ones that can arise spontaneously, which is why, like, we can see HCM not just in certain breeds, but among all cats, the risk is certainly there. The other challenge with HCM is it's a disease of time. So I could scan an HCM carrier as a newborn, as a young cat, and I might have no evidence of hypertrophy of the heart muscle, and that's going to develop later on. We know genetically, there's a bit of a gender bias. So tomcats tend to manifest hypertrophic changes much sooner than females do. We see that actually in the human world as well, which is why, we'll hear about, young men, male athletes. There was that Russian figure skater, who dies of a heart attack, usually in their peak physical condition, and they're quite young, late teens, early 20s. And yet hypertrophic cardiomyopathy is a silent killer among middle-aged older women, because there's no sign for it, and we're also kind of beyond from that gender bias. We see that kind of delay issue. So it's going to be then screening routinely and screening for any evidence of hypertrophic changes as these cats get older. So whether to have a cardiologist scan or not, for me, I just would want to have someone scanning who is very good at getting those measurements and and is consistent at it. So in my veterinary world, I can put my ultrasound probe on a heart and I could say, wow, that heart looks big. But in those measurements, that fine tuning, and that's right, I will refer to a cardiologist for their expertise, since that's all they do 24/7. But I think if you were to find an ultrasonographer, radiologist who is comfortable and accurate in their measurement collection, then no, it doesn't have to necessarily be a boarded cardiologist who does it, but just someone who's an ultrasonographer who has that skill set to pick up those subtle changes of hypertrophy.
Okay. Sorry.
Sorry. One other kind of just comment I will make. So it's IDEX Laboratories. So they do have, just as kind of another kind of test consideration, brain natriuretic peptide, or BNP, the pro form, so pro BNP. So this is an enzyme released when cardiac muscle is under more stress. So in my own cats who are high risk breeds, I'll use this as an initial screening tool to determine whether cardiology intervention or cardiologist is kind of needed if I'm dealing with a cardiac case, or say I have a respiratory distress cat where I'm thinking is it pneumonia, is it like asthma, in a high risk breed situation. So the idea here that as heart muscle becomes more hypertrophied, that heart is under more physiologic stress, more of this pro BNP is released. And so we can kind of quantify that and say, yes, my heart is under stress. I'm going to do more investigation or no, it isn't. The little naked sphinx, my own Zeb, when I first adopted him, he would have been about 18 months. His pro BNP score was normal; it was less than 100, and now he's 3.5, 4, and he has hypertrophic cardiomyopathy. And it was interesting seeing his progression from no murmur, normal pro BNP to now I have a murmur when stressed, elevated pro BNP, and then kind of confirm that with an echo that it's HCM.
Okay, perfect. We're going to wrap up in just a few minutes. I'm just going to try to get a few more questions in if we can. Is there a diet or supplement that you recommend for cats that are FCV positive?
So my go-to probiotic supplement is Fortiflora. So it's Enterococcus faecium is the active bacterium. Why I reach for that is, Purina has many talents, nutritionally speaking. One of their top ones is, man, they can make things taste delicious. So whatever that magical beef bouillon flavoring base in that Fortiflora, if I have an active herpes cat who is sick, is shedding, is congested, that stuff tastes great. So usually compliance is quite easy. Like the cats like to eat it. So that's probably why it's one of my go-tos. The Enterococcus faecium, which is the active bacterium in Fortiflora, has also the most research behind it through Mike Lappin and some of the shelter group research too. So it has been proven at the research level to reduce herpes virus shedding and active infection within shelter cats. So that's why it's my go-to probiotic, because it tastes good and it's been proven to kind of work that way. As just kind of a general comment then about nutrition, so nutritional stress does predispose us for infection as well. So if I'm not eating properly, my immune system is not going to thrive. So again, I guess that just comes down to, no, I wouldn't say I have a specific diet that I'd reach for as much as my probiotics, but I would want to ensure appropriate nutrition, and that I'm nutritionally thriving with adequate nutrition to help just prevent disease in general.
Okay, great. Do you know the percent of infected cats with coronavirus and how it affects a cat's lifespan?
So, oh, coronavirus, that could be a whole lecture in itself.
I thought so.
Yeah, what a crazy disease. So, an infectious disease so coronavirus, the fecal pathogen, highly communicable, or is obviously an infectious. It's a coronavirus. It's very contagious. And I mean, just basing off of the number of positives in my diarrhea PCRs, I see more positives than negatives. So the coronavirus itself is quite, again, very endemic in cat world. A lot of cats certainly have been exposed to it. The FIP form of it is crazily, although still an infectious disease, it's not communicable. And I've seen estimates anywhere from 2 to 4% of cats that are exposed to the feline fecal coronavirus going on to develop FIP. I don't know if I'd quite consider it that high, just from the cat populations that I see. Certainly, maybe so to develop coronavirus or the FIP, it's this kind of perfect storm of an immune system. I'm exposed to the fecal version of it. The fecal version mutates, allowing access through the gut, the macrophages of the intestinal tract into systemic circulation. And I have an immune system that is unable to clear the infection. If I have an immune system that an improper cellular immune response, I think of my immune system, I have antibodies or my humoral system, I have my cellular part of my immune system as well. And so, like wet form FIP is because this kind of humoral form, this antibody production is just ramped up. And we're seeing these antibody antigen complexes ultimately creating this wet form. the dry form of FIP, that kind of waxing and waning fever, random kind of malaise, and that it's usually because, again, I have an okay immune system, but not enough to kind of clear the systemic version of it. So it's to me a very hard concept to, or it's taken me a long time to appreciate that aspect that fecal coronavirus is very common, and thankfully coronaviruses themselves are very easy to disinfect from my environment. So just my routine um, cleaning, dilute bleach, normal disinfection that I should be doing to maintain calorie cleanliness or clinic cleanliness in general, will happily kill the coronavirus itself. It's just once it's in that cat, if the virus, because it loves to mutate and hijacks that systemic form in an immune system that can't clear it, then that's the recipe of FIP.
Great. I'm going to have to stop the questions. I apologize to everyone that we couldn't get through all of them. They certainly were very interesting, and we got through quite a few, so I'm glad about that. It's been a great session. Thank you so much, Dr. Liz, and to everyone for joining us and participating. This was a really great evening, and I'm glad you were all able to hop on and join. So thank you so much, and good night, everyone.
Yes, good night. And from my side, thank you as well. I appreciate it. It's 10 o'clock, if not later, back east. So thank you for joining and for giving me the opportunity to talk. It was lots of fun.
Thanks. Thank you so much. Good night, everyone.
Good night.